Hi, welcome to another edition of Your Health Matters with Dr. Benjamin Bryant, Chief of Staff here at Conneaut Medical Center and General Surgeon. And Doc, it looks like things are going to cool down here. As we tape today, it's beautiful outside, but I guess it's supposed to get a little chilly.
Yeah, it's supposed to get, well, seasonal.
It's seasonal, yeah. It's time.
I was out of town last week.
Yeah, I know you were.
I was actually up in Maine.
Really?
It's nice and cool up there, believe me.
Well, the leaves changing up?
Oh, my God. You know, I'm a Midwesterner, and we have beautiful falls.
Right.
I have to be honest, I have never seen anything like the foliage up there.
No kidding.
I mean, it was beyond spectacular. It was so vivid and bright and just beyond belief. I mean, it was spectacular.
We're a little behind here. It's not...
Sure, they're a couple of weeks ahead.
Yeah. That's
so
great.
far north. But it was getting below freezing at night there.
Was it really?
Oh, yeah.
This early?
Oh, yeah. Well, that's way up there. Maine is way up there.
Mm-hmm.
You don't realize it, but if you look at a map and trace the parallel across, I mean, it's way up.
Did they have any problem with the hurricane?
No.
That didn't bother it?
Not while I was there.
Yeah.
No.
Cool. That's cool.
Yeah, that was really nice.
You know, the last couple of weeks, or last show we did, we answered questions that were sent in by you, the viewers out there. And since then, we've gotten some more. Plus, we have a couple cleanup ones that we didn't get to after the last show. So let's start out with that.
Yeah, we will. We're going to cover those. And again, we tell all of you folks watching, it's great when you send the questions in.
Absolutely.
This show is for you. Things are happening all the time. People are seeing stuff, reading stuff, and if we can bring some clarity and help people to understand the issues that affect them, that's what they call empowerment.
Right.
The more you know, the better off you are. So please don't hesitate to ask. You can write to Pat. We had somebody call my office with a question, which is fantastic. We welcome that. So please, any questions on your mind, please ask them. One of the things that we got asked last time, Pat, was about vitamin C.
Yeah.
And what is it, and what benefits do we get out of it? As it turns out, a lot of research has been done on vitamin C. There's some disinformation out there, but there's also some very important positive information out there about vitamin C. Vitamin C is a water-soluble vitamin. You know, people think about oranges and grapefruits. Of course, they're rich in vitamin C, but a lot of other things are too. And vitamin C supplements. Vitamin C is very, very safe. Okay, you're not going to get in trouble if you take too much vitamin C. It may not do you any good to take huge amounts, but it's not going to get you in trouble. So people should regard vitamin C as safe. Okay. Benefits of vitamin C may include protection against immune system deficiencies. So it strengthens the immune system, which is a huge thing, all on its own. Protection against cardiovascular disease, prenatal health problems, eye disease, and even skin wrinkling. Okay? Because vitamin C is very intimately involved in the health and maintenance of what we call connective tissue, which is what makes up the skin and the tendons and all of that kind of thing. And vitamin C deficiency, the severe vitamin C deficiencies in years past is known as scurvy. Scurvy is vitamin C deficiency. Obviously, it's not contagious.
Mm-hmm.
All right, and that's why once it was figured out what was going on, ships that would sail on the ocean would take oranges and grapefruits with them so that the people didn't get scurvy. A recent meta-analysis, what that means is that they're looking at studies, and the study isn't done, but they're seeing what's going on so far. And what they found was that vitamin C is beneficial to people whose immune system is weakened due to stress. Stress weakens the immune system. That relationship has been proven. And who among us has no stress?
Right.
I haven't met anybody. I mean, we all do. Okay. And if we're under a lot of stress, emotional stress, psychological stress, physical stress, it tends to weaken our immune system. And vitamin C can be helpful with that. And taking a supplement is not a bad idea in that situation.
So people should take a vitamin C.
Bottom line, when we get to where we're going, is yes, it looks like it. It looks like all of us will benefit from getting extra vitamin C.
Okay.
Good evidence that taking vitamin C for colds and flu can reduce the risk of further complications such as pneumonia and lung infections. It's not going to shorten your cold. It's not going to prevent a cold. That's some misinformation out there. Well,
I've heard that forever.
Yeah, if I start getting a cold and I just take a whole bottle of vitamin C, I can prevent the cold. No, that's not going to.
Okay.
But this business about see, we have talked about the influenza on this show several times, and that's a respiratory infection. It's a viral respiratory infection. The problem is that the changes that happen in the lungs because of that set us up for developing a secondary bacterial infection, which is a whole lot worse, a whole lot more dangerous. And the evidence is that vitamin C can help prevent that secondary infection, which is huge. I mean, if you're somebody who would have gotten a bacterial pneumonia and didn't get it, you just got a huge benefit. You stayed out of the hospital, you prevented possibly disastrous complications, and all for a little vitamin C. So that's not bad to know. Research has been conflicting. However, one study in the Journal of Clinical Nutrition found that those with the highest concentrations of vitamin C in their blood were associated with a 42% reduction in the risk of stroke. So there is, like I say, the evidence is conflicting, but this is a situation where we say, okay, there may be some benefit, and if there is the potential that vitamin C can help reduce the risk of a stroke or prevent a stroke is so catastrophic that even if the evidence is conflicting and there's no harm in taking the vitamin C, why wouldn't you do it? It just makes sense, just logical. So there's that. Higher vitamin C intakes were associated with a lower likelihood of a wrinkled appearance, dryness of the skin, and a better skin aging appearance.
Would a multivitamin have enough vitamin C in it to cover this?
Well, you got to look at got to look at the label on that.
Mm-hmm.
Most of the studies examined showed 500 daily milligrams of vitamin C to achieve health results. The RDA recommended daily allowance is 75 to 90 milligrams. Okay, so 500 is way turbo beyond that.
Mm-hmm.
And what you do is you look at your multivitamin and it'll list vitamin C and it'll say how many milligrams. And it's almost certainly not going to say 500. Okay, it's I mean, you're going to get vitamin C. You're going to get enough to prevent scurvy. Okay, but you may not get enough to get the benefits that are appearing in these studies. Now, vitamin C is generic, it's cheap, it's over the counter,
Right.
Okay, and so, taking a 500 of vitamin C every day, that way you're on the right side of these studies. It does say the safe upper limit for vitamin C is 2,000 milligrams a day. Now, to be honest with you, I'm not sure what that. I haven't seen the evidence, which doesn't mean there isn't any, but what kind of complications somebody can get into if they take more than that.
Mm-hmm.
I can't. But number one, I can't imagine it would be too severe. But beyond that, once you get above 500 milligrams a day, it's like pouring water into a glass that's already full. It just runs out. I mean, it doesn't do you any good. So there's no point in taking those huge quantities like that.
I had a cousin that was a very health conscious. He was a pilot in the airlines, and very health conscious, and he overdid vitamins and ended up in the hospital, got very sick.
Oh, you sure can.
Yeah.
Not vitamin C,
No, it was everything.
but there's, vitamin A can make you very sick, can even kill you.
Is that right?
Oh, here's an interesting fact. Along those lines, polar bear liver is toxic
Really?
because there's too much vitamin A in it.
Is that right?
Yep.
Who would have thought?
Yeah, I mean, I just ran into that when I was reading about vitamin A one time. But the point being that vitamin A, if you get too much of it, is toxic. And several of the vitamins are like that. So you want to be in the right dose range. The difference is, I don't want to get too technical here, but vitamin C is water soluble, okay? Which means it floats around in the bloodstream, dissolved, and it gets peed out through the kidneys, and it's really easy to get rid of it.
Mm-hmm.
Vitamin A is fat soluble. It's a different molecule. So it's metabolized completely differently, and it depends on the liver to metabolize it, and it can build up and so on. Okay, so it's just, the RDAs are a good thing to go by. One of the things that I tell almost all of my patients is that they should be taking a vitamin D supplement. We're about to head into our typical Conneaut fall, winter, spring weather.
No sun.
Where we don't get sun, and we've talked about being careful with sun anyways because of the myriad of other problems, skin cancers and so on, that can come from that. So a vitamin D supplement, I'm just going to tell you, if you live here where we do, and you do not take a vitamin D supplement every day, you will be vitamin D deficient, period, end of story. And that is really not good for you, for a lot of reasons, okay? I mean, women and their bones, obviously, if they're vitamin D deficient, they're going to progress toward osteoporosis. There's nothing they can do about it. So vitamin D is critical that way, but it also is important in reducing the risk of a lot of cancers. For example, vitamin D deficiency increases the risk of prostate cancer. Okay? Now, taking vitamin D supplement may not prevent prostate cancer, but if you are someone who would have gotten it because of vitamin D deficiency, then it did prevent it. Okay? So if you have something that, you take 2,000 units, which sounds like a lot, it's not. 2,000 units of vitamin D3. That supplement is available in any store. It's over the counter, it's generic, it's not expensive. If you're taking one of those a day, I mean, you're really helping yourself by doing that. It's an easy thing to do. So just go by the recommended daily allowance, with the exception of vitamin C. The evidence that we have is that 500 milligrams of vitamin C daily is where you want to be.
This viewer here, Doc, it's a lady, I guess, mentioned that her doctor said it's beneficial to take vitamin C for those folks that do not exercise. That doesn't make any sense to me.
Well, I'm not sure why they would have said that, and I'm not sure why somebody wouldn't exercise unless they're physically incapacitated, which some people are.
Right.
But it could be, exercise strengthens connective tissue. It strengthens the tendons and the ligaments and so on. And we've talked about the relationship between vitamin C and the health of those tissues. Right. So that might be what they're talking about. But they work differently, and it's much better if you get a little tension on those, because it keeps them healthy.
Okay, excellent. Another viewer, Doc, I thought this was interesting, says that her doctor told her to eat a handful of nuts every day as a snack, but she doesn't know why. She can't remember why the doctor told her that. And she wants to know, are nuts good for you for a variety of reasons, or what was the doctor's thinking? Do you have any idea?
Well, possibly yes, actually. All right. Are nuts good for you? Yes. Flat statement, they are good for you. Okay? Now, why would that be? Well, what is in nuts? Well, concentrated nutrition is in nuts. They contain a lot of protein. They contain essential fats and oils. But as it turns out, epidemiologic studies, in other words, looking at populations where they eat a lot of nuts and where they don't, differences, you can see differences.
Mhm.
And some of the conclusions that come out of that are, for example, that eating nuts helps to control blood sugar.
Hmm.
So if people have type 2 diabetes and they change their diet to reduce like the real sugary foods and so on, but they eat nuts instead, it's going to help them control their blood sugar.
Hmm.
So that's a benefit. One of the big areas receiving attention these days is the relationship between nuts and heart health. It's thought that the good, see there, you know, you hear about bad fat and good fat.
Right.
You know, and bad fat is the trans fat and the saturated fats and so on. And the good fats are the unsaturated, the omega-3s, that kind of thing, which are important for health of blood vessels and to keep them from getting stiff and tight and thick. And it's thought that the good fat in nuts lower bad cholesterol levels.
Hmm.
So eating nuts can help lower the bad cholesterol, which is the stuff that does the damage. Okay. The omega-3s, one of the things that they do, you know the heart has a rhythm. Parts of the heart contract, the other parts contract, and it's that regular rhythmic contraction that is responsible for the blood flowing properly. I mean, it's absolutely crucial, obviously. And a lot of heart attacks, sure, if you get a blockage of the artery and not enough blood is getting to the heart, you get a heart attack. But that's not the only cause of heart attack. Sometimes what happens is the rhythm goes off, okay? It's called an arrhythmia. That, you may hear your doctor mention that term, arrhythmia. Okay, that's where the heart is not contracting in a coordinated fashion and it stops moving blood efficiently, which, you know, it can make you faint, it can make you feel very sick, it can result, it can be fatal, obviously, of course. And a lot of heart attacks are because of arrhythmias.
Okay.
And one of the things we have here is that the omega-3s in nuts can help prevent dangerous arrhythmias. So all these little things, you know, it's not straight cause and effect, but what we're doing here is we're just adding one card and one card to the deck that gets stacked in your favor.
Right.
That's what we're doing here. Okay?
So obviously, having a handful of nuts is better than having a bunch of potato chips or stuff like that.
No question about it.
Yeah, excellent, yeah.
Contain fiber, which helps with cholesterol. Nuts, possible, not proven, but possible decrease in gallstone formation.
Hmm.
Beneficial effects on hypertension, cancer, and inflammation. Beneficial effects on oxidative stress, inflammation, and vascular reactivity. What does that mean? Well, we all hear about these free radicals and these chemicals, these little chemicals that form in the bloodstream that are very damaging to the blood vessels. And so antioxidants is a big thing in nutrition and health these days. And that's what they're talking about here,
Okay.
is an antioxidant property of nuts. Blood pressure, metabolic syndrome, which Dr. Regula talked about here when he talked about bariatric surgery, all the
Right,
problems that
right.
can come from that. So that's kind of an overview of, yeah, there really is something to this.
Hmm.
And, you know, if people hear this show today and decide, okay, I'm going to take 500 milligrams of vitamin C every day, and I'm going to have a handful of my favorite nuts every day, a couple of steps towards keeping things on an even keel and
Sure.
avoiding problems. What's wrong with that?
Nothing wrong with that at all. Excellent.
Plus, they taste good.
Yeah, we bought a
We
bunch
like
of them for the game the other night, the kind you crack.
Yeah, sure.
Sat there and ate those things and stayed away from the potato chips and all that stuff. And
See, you're on the
felt
right
kind of
track.
healthy today, so. Doc, and another question for you. And it's something I think that probably has been asked to me that before several times, but this came up the other day, and I said I would ask you this. A guy told me that he understood there was a lot of stomach flu happening in the last 2 weeks or so, and he says, I had the flu shot. Well, I guess that doesn't matter. Can you explain all that?
I'm really glad this question came up.
Oh, okay.
I'm really glad this came up because there's a lot of confusion about, quote, stomach flu and the relationship to flu shots and how stomach flu works and just really what's going on there and so on. So there's a lot of information here, and we'll kind of launch into it and see how far we go.
Okay.
Okay. I think the first thing to realize is that stomach flu is a misnomer. Okay. It has nothing to do with the flu.
Oh.
It has nothing to do with the flu. Okay. Flu is short for influenza.
Mm-hmm.
And influenza is the name of a certain kind of virus, the influenza virus, okay?
Mm-hmm.
And that is what the flu shot is directed against, is the influenza virus, okay?
Okay.
Now the influenza virus causes a respiratory infection, the colds and so on. But it could be more serious, muscle aches. I mean, when you get a bad case of influenza, you're sick. It really takes you out. You feel horrible, really tired and lethargic, achy and in pain, coughing. It's horrible. That's what the flu shot is directed against. Okay. It's a certain kind of virus. Now, when we start talking about the gastrointestinal tract, we're talking about completely different kinds of viruses. Okay? They're viruses, but they're completely different kinds of viruses, and immunizations are very specific. They're directed against one organism. Whether it's a bacterial organism or a viral organism, the immunizations, they sensitize the immune system to that particular organism. So if that organism shows up, your immune system is ready and wipes it out, okay? But the influenza vaccine being directed against influenza virus has no effect at all on the viruses that cause the gastrointestinal infections.
Okay.
So they're completely different things. Viral gastroenteritis, there's 4 main viruses that cause that, and 2 of them are really important because they cause the most. One of them is more specific to kids, rotavirus. People may have heard that term, rotavirus. Maybe, maybe not. Most of the adult infections, 90% of them actually are caused by something called norovirus. It's just a certain kind of virus that causes a big problem in the gastrointestinal tract. Okay? There is not a vaccine for that. There's not a vaccine for norovirus. So there's no vaccine for most of the stomach ailments. Now in kids, rotavirus causes the most vomiting and diarrhea, the viral infection of the gastrointestinal tract in kids, and there is a rotavirus vaccination.
Oh.
Every pediatrician knows that, and most kids get vaccinated for rotavirus.
Okay.
And that's really caused those illnesses to decrease. It's fantastic. But for grown-ups, the norovirus, you're on your own. There's no vaccine. Okay? So I want to go into this a little bit so people can understand, and I've got specific recommendations, when you go to the doctor and that kind of stuff. Just to give a little background, once you get the virus into your system, about 24, 48 hours, then you start having symptoms. And you can infect somebody else for 7 to 10 days after you have your acute onset of illness.
Really?
And it can be as long as 3 weeks, but it's usually 7 to 10 days.
Wow.
Yeah. Yeah, so that's how it spreads. Within households, infection develops among about 50% of the exposed children and 15 to 30% of adults. So if somebody has viral gastroenteritis. So, oh gosh, they got the stomach ache and they're throwing up and diarrhea and just feel terrible. Everybody knows what we're talking about here, okay? And somebody in the household has that, about 1 in 3 people are going to get it.
Mhm.
Now, I've seen it higher than that, of course, but,
Right.
and it just depends on how you handle things, which we'll talk about.
Do you have to just weather the storm then, if you're an adult?
Well, in a sense, yes, but it depends on what direction the storm takes, and we'll get into that.
Okay.
Okay. It's spread by ingestion. Okay, contaminated food. Somebody has viral gastroenteritis. Somebody gets viral gastroenteritis. Okay, and they don't wash their hands, and they're involved in preparing food for Thanksgiving. You can bet that most people are going to get sick.
Is that right?
Yeah. If you have the illness and you've had it within the past 2 weeks, you should not be preparing food for the family.
Wow.
Okay? Not unless you're very, very careful about meticulous hand washing. Okay? Because it's so easy to spread it that way. Okay? If somebody throws up and there's an aerosol from that and you breathe it in, you can get it that way. Okay? So you got to be very careful about that stuff. Somebody throws up, clean it up right away with absorbable towels, put it in a waterproof bag, okay, and get rid of it, and wash your hands really well. Wipe everything down with bleach.
Bleach.
Bleach. You can dilute it. They've been calculated how much bleach, how strong does the bleach have to be to kill these viruses? Pretty strong. It doesn't have to be straight out of the bottle. You can dilute it some, but 2 to 1 or something like that, it's going to kill the virus. And we need to be very careful about that. One of the questions I get asked is, well, you know how the immune system works. If you get this norovirus and you've had that, now you're immune to it, and you won't get it again. Unfortunately, that's the way it works with a lot of kinds of infections, but not this one.
You can get it back.
You can get it again. That does confer some immunity, but it's short duration, and it wears off quickly, and then you can get it again. So the fact that you've had it does not protect you. Outbreaks. Okay, boy, the flu we've had an outbreak, a lot of people are getting it. Outbreaks occurred in restaurants or events with catered meals in 39% of the time in one study. Hospitals and long-term care facilities, 25%. School and child care settings, 13%. Vacation destinations, including cruise ships, 10%. So that's kind of the breakdown of where the outbreak starts. Measures to reduce the risk of norovirus transmission. So what we want to do is if somebody gets sick, we'd like to have nobody else get sick if possible. Okay? Attention to hand hygiene. Washing hands with soap and water after contact with anyone who has the infection. Disinfecting surfaces with bleach. Okay. Now, some of the doctors who provide the information to medical websites that a lot of doctors use, got together and put together a list of recommendations for dealing with stomach viral. I'm not going to say stomach flu because I don't want to perpetuate that. It has nothing to do with the flu. Okay? It can cause diarrhea and vomiting. What happens is the stomach or intestines get infected with the virus. They screw up the metabolism because of the effect they have on the cells, and then all these other symptoms happen. People can get it if they touch an infected person or a surface with the virus on it, and they don't wash their hands. Eating foods or drink liquids with the virus in it. If people with the virus don't wash their hands, they can spread it to, like we talked about. Okay? What actually are the symptoms? diarrhea and vomiting, cardinal symptoms. Sometimes, however, you can have a fever with it.
Mm-hmm.
Not everybody does, but you can. A headache or muscle aches is possible with it. I'm sure everybody can relate to that.
Mm-hmm.
Belly pain or cramping, and a loss of appetite. And it can be really unpleasant. I mean, you can have terrible cramps and just really feel badly from it. Now, here's the deal on it. That is unpleasant, but it's not particularly dangerous. What's dangerous is if you get dehydrated.
Mm-hmm.
And it's very, very easy to get dehydrated if you have this illness because you're throwing up, so you're losing water. You have diarrhea, you're losing water. Your appetite's off, you don't feel like drinking, so you're not taking it in. That's a fast spiral. And if you get dehydrated, now you're in trouble.
Mm-hmm.
And that's where the really bad complications from this come from, is from the dehydration. All right? It can make you feel thirsty, tired, dizzy, or confused if you get dehydrated. Severe dehydration can be life-threatening. Babies, young children, and elderly people are the ones who are most at risk for a dehydration that can get them into serious trouble. And it can happen with kids just like that. It's very fast. Kids, the younger they are, the faster they get in trouble. So if you have a child that is exhibiting these symptoms, fussy, won't drink, throwing up, having diarrhea, okay, you got to be on top of that kid because they're going to get in trouble. They're going to get in trouble within 12 hours.
Well,
okay.
how long does it flu generally last, Doc?
This
What we're talking
about
yeah.
here. Well, the really intense symptoms are usually 2 to 3 days. They can last a little longer than that, but most of the time they don't. Somebody will get it, and they'll say, "Oh, I'm starting to get it," and it comes on fast. Everybody knows what I'm talking about.
Mm-hmm.
You're feeling okay, then, oh man, I'm starting to feel bad, and within a few hours, 3 hours, wow, they know. All right, and then the next day is bad. They're just wiped out. Okay, the day after that, they start to perk up a little bit, and by the following day, they usually, oh, okay, I'm feeling a lot better now.
Sure.
Okay, so it's generally like that. Now, but that's a good point, because if it goes on longer than that, then something else is going on.
Mm-hmm.
Okay? Do people with this problem who get this, do they need tests? Not usually. Usually you don't need tests because, we know what causes it. There's no vaccination for it. There's no specific treatment for it. So it doesn't really add anything unless you're worried about somebody getting dehydrated.
Mm-hmm.
Then they need blood tests, urine tests, that kind of thing. Is there anything I can do on my own to feel better or help my child? Yes. Drink enough fluids. Turbo the fluids. That will really blunt the really severe symptoms that go along with this. Some fluids, of course, are better than others. Older children and adults can drink sports drinks. Babies, you can give them Pedialyte, which is available in any drugstore. And that's very important. It's not just the fluid, it's the electrolytes, because you're losing those. So you got to replace them. If your child is vomiting, you can try to give your child a few teaspoons of fluid, which isn't that much, every few minutes. So you just kind of really work with them. Babies who are breastfed can continue to be breastfed. Okay? You should avoid taking juice or soda because they can make the diarrhea worse.
Mm.
That has to do with how the virus actually causes the problem at the cellular level. Okay? If you can keep food down, it's best to eat lean meats, fruits, vegetables, and whole grain breads and cereals. Avoid eating foods with a lot of fat and sugar because they'll make it worse. That's just the way the cells are behaving because of that darn virus. What about things to slow the diarrhea down, like low modal, that kind of thing? Be very careful with that. Be very careful with that, because it has, those things have side effects, and in the setting of an acute gastrointestinal infection, they can cause some really wicked problems. So you want to be a little careful with the antidiarrheals. It will run its course. If you can keep up on the fluids, you're not going to get in trouble. It's not going to last that long. Okay. Now, one of the questions that people have is, well, what about an antibiotic? Well, the reason why an antibiotic is not useful in this situation is because it's a virus that's causing the problem, and antibiotics are directed against bacteria. We do not have good antivirals that specifically go after the virus itself. The antibiotics go right after the bacteria and kill the bacteria. We don't have anything like that for viruses. So antibiotics, as a matter of fact, antibiotics can make things worse.
Okay.
Because antibiotics will kill the good bacteria in the intestine and make things last longer, make it harder to recover. There's some evidence to suggest that probiotics might be helpful in this situation. Weak evidence. Okay? Should I call the doctor or a nurse? Well, if you or your child has any symptoms of dehydration, dizziness, confusion, if you feel faint, okay, if you see your pee get really dark because it's getting concentrated because you're not getting enough fluid, okay, has diarrhea or vomiting that lasts longer than 2 or 3 days, okay, if you throw up blood or you see blood in the stool, that's a very different situation. You absolutely need to see the doctor at that point. If you haven't had anything to drink in a few hours for children or in many hours for adults. So in other words, you know, you have these symptoms and you just don't feel like drinking, or you offer fluids to the kids and they won't take them, okay? And if that goes on more than a few hours, then you need to seek medical attention. Probably get an IV and get your fluids back that way, which is a great way to get fluids back and can protect you. Most people, as we've mentioned, most people don't need specific treatment because there isn't any, and because it's self-limited and will go away as long as you make sure you keep your fluids up. Can it be prevented? Sometimes, not always. Sometimes you can do the best you possibly can, it doesn't help, okay? But washing, hand washing, okay? And wiping surfaces down with bleach. You know, and if somebody's sick, they throw up, you get their bedclothes, their clothes, and put them in a waterproof bag. I mean, that's where the contagion comes from. Okay. All right, so I mean, that's a lot of information, but I'm hoping, because this is so common, and so many people get it every year, I think it was really important to try to give a big picture of what this is, how to understand it, reassure people, no, you know, you don't need antibiotics, there isn't any vaccination for it, it has nothing to do with the flu. Wash your hands and keep infected things away from everybody else, and really get plenty of fluids, and you'll weather this right out.
Okay, very good.
Okay.
Interesting.
I hope that's, I mean, I know that's a lot of information, but I hope that's useful for people, because
Well,
we're all going to.
I didn't know a lot of that stuff that you mentioned, and certainly you've always been a stickler about keeping your hands washed. Something that I didn't do that much before, but when I worked at AM Live, we had all kinds of things and people, and we touched a lot of stuff, telephones and all that stuff, and I started washing my hands like during the show and afterwards, and knock on wood, I kept pretty healthy during that time, you know, so.
There you go. You know, there's a big emphasis in medicine these days about injury to patients while they're in the hospital, okay, and that's a big, hot topic. And there's lots and lots of studies going on, you know, adverse events, that kind of thing. And all of the studies are saying the same thing. The number one factor in preventing adverse events in the hospital that are preventable has to do with hand washing.
Is that right?
Still. So that's how important it is.
Yeah.
Well, I want to shift gears here real quick, because we did have a patient call the office to ask about phytoestrogens, which are plant-derived estrogens, and the relationship between those and osteoporosis. And we can cover this really quick. When we're talking about phytoestrogens, what we're really talking about here is soy foods and soy dietary supplements, okay? Results from epidemiological studies, that means they look at populations and see how they behave, suggest a beneficial effect on the bones in Asian women consuming typical Asian diets, which have tons of soy. Tons of soy, okay? Clinical trials here in the United States conflict. The data conflicts, it's not clear, okay? Regarding the effects of these on bone mineral density in pre- and post-menopausal women, okay, they conflict. And a lot of it has to do with the methodology. The studies aren't looking at the same thing. They're not measuring in the same way. It's just not very well-designed studies. And when you have that, you can't really get useful information out of it. All right, so that's part of the problem. Published data are inconsistent and do not support soy's protective effect against bone loss. Okay? Doesn't support it. You may read various articles about people in Asia and so on and so forth, but the actual data so far, it says, no, we don't see that people who get extra soy and all of that sort of thing, we don't see that it's helping their bones. We're looking at it scientifically, and we don't see that it's helping their bones. So take that into account if you're going to embark on a big supplement kind of a program, that the evidence really isn't there to support that.
Okay.
Now, Pat, you had mentioned in closing today, you had mentioned that some questions had come up about the availability of doctors here in town. Could you tell me a little about that?
Yeah, a gentleman told me the other day that he had heard a story or rumor that there's a shortage of doctors in Conneaut, and because of that, if you have to come here to UH for sickness or an injury or something, that he is understanding that these patients are being sent to Geneva. All new to me. I've never heard this before, so I thought I would bring it up to you and see what you had to say.
I appreciate the opportunity to nip it in the bud.
Okay.
As they say, nip it in the bud. We've got to have a little clarity about what we're talking about here, okay? As far as primary care doctors, internists, family practice, and so on, there is no shortage in Conneaut.
Okay.
There is no shortage. If you need a doctor to be your regular doctor, to do your checkups and preventive and that sort of thing, or somebody to admit you to the hospital, if you need to go into the hospital, absolutely have that here in Conneaut, okay? You're not going to have to look outside of our town to find a regular doctor who's with university hospitals. Just simply not, that's not factual, okay? I think that where this is coming in, sometimes people will hit the emergency room and they have a problem that is complicated, okay? The kind of thing where, for example, you need access to specialists that we do not have on staff here. You are going to need, potentially going to need procedures, and we don't have people who on staff who do those procedures.
Right.
In those cases, very likely you will be transferred, but you will not be transferred to Geneva. You will be transferred to Geauga. okay? I've mentioned this on the show before, and I'm grateful for the opportunity to bring it up again. University Hospitals has made a commitment to developing Geauga as a regional center for the eastern part of their service area. What that means is really building Geauga up.
Mm-hmm.
Building up the specialties, building up the equipment and the technology, and a tremendous amount has happened in just the last few years along those lines. The addition of radiation oncology at Geauga is an example. That costs millions and millions of dollars, and it's there now, and the specialists are there now, and that's happening kind of across the board. So what that, and the reason that is that our Conneaut people now do not have to go to Cleveland. The kinds of things that are being done in Geauga now, 5 years ago, people would have had to go to Cleveland.
Right.
And now they don't. And I don't know, anyone with experience will tell you it's a whole lot easier to go to Geauga than it is to go downtown in Cleveland.
Oh, sure.
Way easier. Way easier on everybody. So it's not uncommon for somebody to hit the emergency room and they get assessed. A lot of times I get called, if it particularly on a surgical sort of a thing, I get called, and then I have to make a judgment call, okay? Is this something, see, the whole emphasis within UH is making sure that the patient gets the best possible outcome. That's what we're interested in. We want the best outcome, okay? And so the question comes up, where is this patient most likely to get the best outcome? And there are a lot of things that come up that are very technical, and as the knowledge base expands and the specialties get refined, you want your care to be delivered by people who are very specific to that particular problem. Now there's a lot of problems of a more general kind that we can take care of here, okay? Like I'll give you for an example, I'll give you a pretty much of a classic example.
Okay.
Patient comes into the emergency room with acute appendicitis, and I get called, okay? And what I will tell that patient is, we can remove your appendix here in Conneaut. It's a very standard, straightforward thing. It's a traditional incision in the right side of the abdomen, small incision in the right side of the abdomen, take the appendix out. If you want to have it done laparoscopically, then what I tell them is that's available in Geauga, okay? So they have a choice. And they can stay here and have it done and not have to travel, or they can go to Geauga and have it done laparoscopically. Now, which is better? Well, that gets into a whole huge discussion, and maybe we should talk about that on one of the
I'd like
shows.
to. I would.
Yeah, I'm glad that came up. Sometimes somebody has a more difficult problem. Somebody comes into the emergency room, they've got perforated diverticulitis. Okay, they've got diverticular disease, they've blown a hole in their colon. They've got a terrible abdominal infection, okay? They're going to be very sick, they're going to be in the intensive care unit, they're going to need surgery certainly, but they're going to need a lot of other things. That is not an appropriate thing to attempt out here in this smaller hospital.
Okay.
So a person like that will be transferred to Geauga and get their care there. So again, you have to think about what kind of doctor you're talking about. Okay, so for primary care, there's plenty of availability here in town.
Okay.
You don't have to go anywhere. Some of the things, endoscopy and outpatient sorts of surgical procedures, certainly done here. Orthopedic, of course, Bill Seeds is very, very active here.
Yeah.
But if it's more complicated medical problem, more complicated surgical problem, we want to make sure that everybody gets the best possible outcome. That's the reason for transfer to Geauga.
Okay.
So I hope that answers that question.
And we do have doctors that can admit here, right?
Oh, gosh, yes, absolutely.
Okay, because I had heard that there were certain doctors that didn't want to get in to be in the admitting role anymore.
Well, that's true.
Mm-hmm.
That's true. But we have doctors who are sort of dedicated to admitting to the hospital.
Okay.
For example, Dr. Kumar
Mm-hmm.
will admit. Dr. Houston will admit. Dr. Abby will admit, okay? Dr. Miranda will admit, okay? Dr. Singh does not admit to the hospital anymore.
Right.
You know, he's got a very busy practice, but if his patients need admission, then one of these other doctors will, hospitalists will do the admission. So you know, if you have something that's appropriate for this hospital, you will always be admitted here.
Okay, okay. That's all cleared up then. Very good. Very interesting stuff. The two questions that I got were regarding the stomach flu and the doctor availability, and you answered them very well. So, and I'd like to get into the surgical side that you mentioned. That was my next question. I'm glad I didn't ask it because it probably would have taken up a whole another half an hour. But I would be interested, and I'm sure a lot of our viewers would be too.
We'll definitely cover that.
Okay, excellent. Good job. Good job.
Okay,
today.
well, folks, I hope that this, I mean, I know it was a lot of information. Again, within a couple of weeks or so, this show will be up on YouTube. Okay, so you can go up on YouTube. You just go up to YouTube and you search Your Health Matters and then put in my last name. A bunch of shows will pop up. You'll be able to find it. If you want to watch parts of it again to get the information. As always, we're very happy to take your questions, and please keep on sending them.
Yeah, please do. Remember, your health matters, and we'll be seeing you again next week.